Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the show for you today? I can't believe what we're finally talking about. Cellulite. Cellulite. So you guys know we had the Faja Doctor on a previous episode, and we were talking about her going to have a procedure to help her with her cellulite. And during the process of her having her procedure, we also got to connect with Leslie, who is our rep for Aveli. So you guys know, I always tell you the behind the scenes, we get to know everything. We get to learn about all the new stuff. We get to hear what procedures are working over here, what's working over there. And the best information comes from the reps because they get to talk to all the different offices. They get to see what's going on, who's working on certain things and who's working on different things and what are they doing that they're not doing and what's working. So with all of that said, cellulite is at the top of the list of the things that patients or clients come and they're asking for. Usually it's on their booty or on their legs. So today, Leslie, I am so excited to have you on and for you to be our expert and tell us everything that we need to know about cellulite and how to treat it.
Yeah, so excited to be here and to talk about it as well. I think that it's not talked about enough and something that I hope we can touch on today too, and maybe help some of your clients and any listeners that are going to be having either surgery or have had surgery is I don't think that it's brought up enough. I don't think that patients realize that there are options for them. And so they just don't even talk about it. They just assume that it's something that they have to live with. So I hope to debunk that myth that you don't have to live with it if you don't want to, and that you do have options to treat your cellulite.
Absolutely. What I like to do on the show is very consultation like behind the scenes, what you would hear. So let's pretend I'm the patient, okay? And I have cellulite, which I do have cellulite on the back of my legs. I'm not.
9 out of 10 of us do.
Yeah, 90% of us do. So the math is mathing.
Exactly. Yes. So I'm going to be our patient today. And let's say I'm coming in and I am talking about the dimples in my booty and the cellulite on my thighs. Why don't you tell us a little bit about how do we even get cellulite? Why do we get it?
Yeah, it's not even something about how or why necessarily. I think that we've always been told for years, which is why the industry has created all these creams and potions and lasers and preying on our desire to have the smoothest legs possible, is that we think that it's something we did, it's our fault or it's our diet or, all these other things. And sure, having, tighter, more toned skin, makes everything look better. It's why there's a tanning salon next to every gym, having a nice tan, camouflages a lot of things. So yes, all of those things will help. But my own young daughters, of all ages, since I was a teenager, I've noticed cellulite. So the good news is, I guess good news or bad news, however you want to look at it, is that it's not your fault. There's nothing that you did that caused this. It's just our genetics. And all it really is connective tissue, which is everywhere, right? We have connective tissue that's connecting our skin down to our muscle, all over our body. It just so happens that for women, we have a lot of these really strong septa or connective tissue in our butt and thighs. And it's kind of like when you look at a mattress or a pillow that has, a pin in it. The more sort of tissue we have or fat that we have surrounding where those septas are, it's just going to make that connection look deeper and larger. And so the only way, after you see what, the Aveli procedure does, and once you learn about that, you can understand why those creams and lotions and potions and lasers and anything that was topical was never going to treat your issues. Even I'll read a lot and listen, I love me a lymphatic masseuse. Like that's my favorite thing, even to this day. I love going to get in those. And I think that they have a lot of benefits, but even a very strong, like lymphatic massage is not going to cut the septa. They're so strong. They are incredibly strong. So the only way to truly get rid of them is to cut them. But it's not, again, anything that we did or didn't do. It is just genetics and how we were made. And some of us just have more of it than others.
So then tell us a little bit about how the procedure works.
Yeah. So I actually have my device. So for anyone that gets to watch this, I guess, it doesn't plug into anything. Like there's no machine, there's no heat, there's no energy. You literally just open up a little device. The only like kind of electrical part of it is the little light that turns on. And that's just so that it can guide the provider underneath the skin to where your depressions are. So they'll start by having you stand up and marking all the depressions that you can see with the naked eye. And then kind of ask the patient too, like, hey, like, is there any particular areas that bother you the most? Or, a particular dimple that, has been bothering you you want to make sure that we treat. So kind of get feedback from the patient, mark everything. And then it's just 2 tiny incisions in each gluteal crease. So it should be very, very well hidden. And if you've had like a previous BBL or other procedure, oftentimes we will make sure that we're trying to use those same incisions. So we're not creating anything new. And then if you are doing this awake, then you would just have some numbing fluid that's delivered along the pathway that they're going to travel to get to each dimple. That's probably the most, would you agree, Diana, the most uncomfortable part of the whole procedure is just the numbing. Like once you're numb.
I don't remember the numbing, which is crazy.
Great.
But
yeah,
I was distracted.
exactly.
I had fun conversations. I don't remember. I was scared of the numbing, but I remember not remembering it.
Yeah. And that's most people's experience with it too, is that like it's either a non-issue or you're like, I was afraid about the numbing, but then like once I was numb, it was fine. So if anything, that's the scariest part. And it's really like a nothing. Once you're numb, you don't feel this anymore. So then they travel to where those depressions were marked using the light underneath the skin. So it kind of can guide me and I'm like, okay, yes, I'm right where it needs to be. And then the coolest thing about it is that, so then you can deploy this hook. And when the hook is out, it's dull. There's a blade there, but it's completely blocked by a little blocker that's on here. And they can then pull back and check, and you actually see the dimple being recreated on the skin, like as you're pulling the device. So and if it's where you marked, you're like, okay, yep, this is a septa that I want to cut. And then you just move, it's hard to see it in the video, but you move the blocker out of the way by pushing another button, and it actually exposes like the tiniest little blade that then cuts the septa. But where I think a lot of other ways of treating cellulite have failed is that, not that subcision doesn't work, right? There's been like, you'll have a doc who'll be like, oh, I use an 18 gauge needle or a pickle fork or Selfina device, all subcision. There was no way to go back and verify, check your work. Like you were just kind of like going in blind. With the light and the hook that's blocked until you want to cut something, you can continue to go back into that dimple and keep deploying the hook and checking and cutting septa until within that small depression, you're like, I'm cut, it's clean, like nothing's catching anymore. And so I'm done. We have verified. And usually I have my providers like grab a marking pen that they have working and exit off. So we know like that one's done, let's move on to the next one. And we treat each depression individually until it's fully cleared, knowing that, yes, now we're done. There's gonna be no more septa there.
Mavi, I actually have clips of how Dr. Marshall released the dimples. You can literally see it. And the light, I feel like it's like a very high precision tool. You guys did a really good job with that. The light, you can see it right through the skin. I don't know about you, but like when I was a little kid, I would play with a flashlight and shine it through my skin, my fingers.
Yeah.
It's like that, but like more precise and actually more bright because it's your fingers are much thicker than that skin layer. So like you can really see the light. Yeah, it's really impressive.
Which is great too, because it helps you understand not only where you are in relation to where the cellulite depression is, but also how deep you are. Like if I can't see the light or the provider can't see the light, they're too deep. Like they need to redirect their device. Whereas again, like if you've got any other thing that you're trying to use, like are you in the right layer? I don't know. It's very hard. And our butts, for most of us, we would like to believe that our butts are not flat. They are very round. So like to drive a device that's flat through a rounded structure, like it is very difficult to ensure that you are in the right plane without the light because of the curvature of our butt or even just our thighs. And again, everything that I described goes for butt and all throughout the thigh. So you can treat your posterior thigh, the lateral or the side of your thigh. Even most of the time, if a patient says they have dimples on the front or anterior part of the thigh, it's usually skin laxity. And so you have to really like make sure you're identifying which is which. But if they do have like a true dimple, which I've seen some already, you can absolutely treat the front of the thigh too with Aveli.
You guys know on the show, I don't usually like to follow the trends. I like to wait for something to come out, watch it for a while and see how it does. And for Aveli, I actually didn't just hear it from Diana. I've probably heard it firsthand from about maybe 10 surgeons who are telling me that they're seeing really great results, that they're really happy that they added it to their practice. I've even had surgeons who used to offer Cellfina who are now switching over to Aveli. And I know when patients are, or if somebody's looking on the internet and they're looking for information about cellulite, Cellfina will come up. So I want us to talk about that. Let's talk about usually what are the options when you do have cellulite? When you look on the internet, what options do you find? You'll find of a lot of things because literally the person who cures or finds the fix for cellulite is going to be a mega millions because every single woman struggles with it. It's not to some degree, some of us worse than others, but everyone. It does not discriminate it's age, skin tone, nothing. It's gonna be there. So Cellfina is one of those procedures that you'll come across. And I have firsthand experience with Cellfina actually like watching it get done, helping a patient through it, through their Cellfina journey. And the thing that I really, really disliked about it was really painful for the patients because it actually comes with like a device. It's like this big like shape and it has no safeguards for how much tissue is being disrupted. There's a ton of bruising. There's a ton of swelling. The bruising lasts for a long time, sometimes staining the skin. We saw results from it, but it was also kind of, now that you describe the Aveli versus that, I totally see like, okay, doing it blindly versus a very precise device.
I will tell you in my conversations with surgeons who've used Cellfina and like even just in my previous like roles, right? So I used to be in lipo sales and, so I've been in plastics for a while and specifically body contouring. So I see the problems. I've been seeing the problem with cellulite, for a long time, hoping, for a real solution. And I saw Cellfina too. And I think that not to totally poo-poo on it. I mean, it was the best I think that we had. I will say, because it was subcision and we know that subcision and cutting the septa is what works. It just was overly traumatic for what you were trying to do. So you were creating like all of this additional trauma that wasn't really doing anything. And for each depression, because it's like the little disc, you had to make a new incision with the needle. So then you have like all these little like incision points and it was a small needle, but then once you turn that machine on and that thing starts to wave around, you kind of would notice that the little small incision that you had made kind of got a little bit wider. So they'd end up with like all these little kind of like poke holes in each part that there was a dimple. And then you're just kind of swishing around. And again, another thing that like hit me was like an aha moment in watching them, in comparison with Aveli is that there are some septa, especially once a patient's laying down, everything looks good, right? Like suddenly everything's smooth and like you can't see any septa. And the septa that was once like when you were standing like really strong and tugging, you're laying down and now it's like loosey goosey, right? It's like a spaghetti noodle. And you'll find that, or I'll find when I'm with a provider and they're pulling and to check the septa, sometimes they're about like an inch outside of the depression before they finally hook it. And then you see it up here. So like my device is way down here, but I'm seeing it now finally pulling, which tells me that septa was long. So if I'm just focusing on here, I'm probably moving that septa around, but I'm never actually catching it because it's a longer piece. So I think what people were seeing with Selfina was like, I'm seeing results, but like, it was like 40% better. It was like 50% better. You're like, it's better, but like not great, you know?
Is it a home run for the price? Because that's the other thing. When you're looking at different procedures, you're also thinking about your price range, right? So like, okay, we all have a 10 procedure long wish list of
Right.
things we want to do. And when you start adding it up, it's like, oh crap, okay, am I going to have to take out another mortgage for this or something?
Right.
So cost becomes something at the top of clients or patients' minds when they're comparing these procedures. And honestly, for the amount that it costs to do a Sulfina procedure and to only see a 45 to 50% improvement, I wouldn't be that ecstatic about it.
And also like that 40, 50% improvement, like we were saying at the beginning, I can't guarantee you which ones of those are going to be 40 to 50% improved. So like, what if the one that was bothering you the most, like you're like, oh, I have all these, but then there's this like one, you know, that's like really deep. I don't know. Like, I'm going to treat all of them with this thing, you know, and then like, we're going to cut some septa, but like, I don't even know if the one that was bothering you the most is going to be like the one that's going to get the best result. Like, I'm going to just kind of give you an overall like better. So it's just like, there's too much like uncertainty.
So, Diana, why don't you tell us a little bit about how the whole experience was for you?
So I'm gonna start with, well, I've heard about it on the internet from Dr. Azizi on his page, and then I saw more and more. I follow a lot of plastic surgeons as well. More and more plastic surgeons posting about it now, even more. Like it's just increasing, and I'm happy to see it because I'm so impressed so far. But I'm about a little over a month post-op now. I went to Dr. Andre Marshall in Beverly Hills to get my Aveli done on both of my cheeks. My right cheek has severe cellulite, or I should say had, past tense, okay? Past tense. Had severe cellulite. My left cheek had moderate. And I had like 1.5 BBLs, but let's just call it 2 BBLs. And the more fat was essentially injected into my butt, the more obvious the dimples became, because now the septa is pulling on more, and now the dimples are going to show more. So a lot of my BBL sisters, you know, this is a plastic surgery podcast.
Mm-hmm.
A lot of my BBL sisters, if you have more you feel like you have more cellulite, it's the same amount of cellulite you had before. It's just more noticeable now that you have more fat there. My procedure was great. I was able to sit right away. I leaked for, it was a little under 24 hours, but I had like absorbent pads and everything over the 2 incisions. And speaking of incisions, 2 tiny holes, and we reused exactly how Leslie said. We reused my previous BBL incisions. I already don't see them like 1 month post-op, but my skin heals well, so that's, not everyone has that benefit, but you know, I'm happy to say that I'm not seeing it anymore. But the procedure, I also had lower back liposuction. I remember feeling that. I don't remember feeling the Aveli at all. Like I feel like maybe I had one like millisecond like moment of, oh, what was that? But other than that, it was very pleasant for me. And I did not have any Pronox gas or anything, which by the way, where was my Pronox? I definitely had regular numbing though. So yeah, I don't remember feeling that. That part was pretty quick. The lower back lipo, that part took longer, but that's a different topic. I didn't have bruising right away. My bruising started to develop about on day 3 post-op, but it was very, very minimal from the Aveli. My lower back, that thing was dark purple, but my Aveli, my butt cheeks didn't, like it was like a lighter brown, you know, like the end stage of a bruise color. As of right now, 1 month post-op, it's looking so smooth. My expectations were exceeded more than I expected. And really it was because, you know, like I also researched Selfina, and then there's Quo, which no longer exists, by the way, for a good reason. And like all these, obviously creams, oh my God, creams, spaceship blasters, you name it. There's so much on the market because we, you know, so many of us struggle with cellulite. I researched Quo, it didn't really feel right to me at the time. Then I heard Selfina. It was actually recommended to me by a plastic surgeon whose opinion I really, really respect. But I looked into it and it wasn't very convincing. And then I heard about Aveli. I kept seeing it. My surgeon told me about it because he was aware of my issue with my cellulite. And I looked into it. I'm a researcher, like I will research. I looked into it and it was immediately very like, oh, this is a very logical approach to actually eliminating cellulite. This actually makes sense to me. Like I'm big on that. Like it has to make sense to me. So I felt convinced, in addition to having seen some very impressive before afters. One of my dimples on my right cheek, on the more severe one, was so big that it created like a little bit of a peak on my butt cheek. And it wasn't like, my surgeon did not give me a peak. It was not his fault. It was the cellulite. It was a septa. That was a really, really big one. That one, by the way, is my only remaining bruise as of today. And it's about probably like this size. What is that? Like a little plum.
Mm-hmm.
And there's a little bit of a nodule. However, I'm massaging it and it's been decreasing. It's noticeably decreasing. My left cheek, I'm obsessed with it. Like I'm so happy with it. Right cheek, we're still healing. Got that little nodule where my biggest dimple was. It's going down. Bruising is also fading. Still using bruise juice on it. And the peak is gone. The peak is gone. Like my cheek has like a much nicer shape. I have so much confidence now. I can't even tell you. I've always been a leggings girl, but I am wearing the crap out of these leggings nowadays. Like I'm at the grocery store just doing the most. So the confidence is everything for me, and I'm loving it.
That's such
Loving
a
it.
great point, Diana, too, because I think in my conversations with plastic surgeons and a lot of them are men, right? So like, struggle with it. Like, do you like? Sometimes they're like, oh, like men don't even think about it. I'm like, okay, well that's good, but like we do, like because it's not just about. I'm not coming in here for you to do this cellulite procedure because I want to wear a thong on the beach. Like I might wear a thong on the beach, but there's also like leggings that I want to wear and I don't want to have to be like covering up my butt because you can see everything. Or like white jeans or a form-fitting dress that you're like, oh, you turn and you're like, yeah, you can see everything. Like, no. It's the clothes. Like there are certain clothes that you can wear. Listen, if you're confident, like wear it. Like for me personally, like there are certain choices of clothing that you're like, I'm not going to wear this because you can literally see like every little lump and bump and dimple on my butt and thighs if I wear
like
this.
light color pants. Forget about it.
Forget about it. Yeah. So all about the clothes too. I think that's a great point, is that it's about feeling confident in the choices of clothes that we're able to wear, like shorts or a skirt or whatever. It's not just about like, because you're going to be, on a beach in a thong bikini. Although
100%. I was starting to notice myself intentionally wear like a longer purse to hide my right cheek with it.
Wow.
So that's where I was. I am not hiding the right cheek anymore. So it's a great sense of freedom. And I love to get cute. I love clothes. I love shopping. So being able to have the freedom of picking really what I want. And you know what? I'm like, ooh, I should have got Aveli on my legs too.
Yeah.
Because now I still have some cellulite on my leg too. But like really the parts that bothered me the most were my butt cheeks, and that's resolved now.
Do you feel, Diana, like the result that you're seeing on your booty now is like seeing your BBL for the first time again?
Yes, I do. I really, really do. Because I couldn't really enjoy it before. And I know that Dr. Azizi did his thing. I know he did. But like the stupid cellulite was not letting me be great. And it was particularly challenging for me because here I am in the public eye, in this space, with a BBL, and here I am with this messed up right butt cheek. It's no one's fault. It's just my genetics. Right. I saw my before pictures. Oh my God, the right cheek was just like angry looking. It's just like all tense. So I knew going into my plastic surgery journey, I'm not a one round body. I knew that. I was very realistic about it. And I had my one round and I had my second round. The second round made the dimples, even more obvious. So then I went in for, and it's not, I'm not considering it a round. It was like What would you
Touch up.
consider it? Yeah,
Touch
like a
up.
touch up.
Yeah, like a little fine tuning.
Yeah, like a fine tune. Yeah, and the Aveli was a bomb addition to the fine tuning for me.
I want to say three things. The first one is you look better than you think. And sometimes the things that we look at ourselves and we
Hmm.
like zone in on like this one dimple on my butt cheek or whatever it is. And then to everybody else, you're like so beautiful. Nobody even notices it. They're like, "Oh my God, you look so great." And I had this conversation with somebody earlier today because she was showing me pictures of herself before and after surgery, and there was something, and I was like, "You look amazing." I don't even see what you're referring to. And although we always want to validate your feelings, and of course, if it's something that's bothering you, we can try to find a solution for it. But I want you to know that most of the time, people aren't even looking at what you're looking at. And the second thing I wanted to say is because we're in this space doesn't mean that we're perfect. Like I am the furthest away from perfect, and I want our listeners to also, when they're on their surgery journey, we're not chasing perfection because
Yeah.
that's a road down to disappointment. And I don't
Hmm.
want any of us to be setting ourselves up for being disappointed. So having realistic expectations with what you're going to be having for surgery and also your results. And cellulite is one of those things that kind of comes up, oh, after my BBL, I have so much more cellulite. And the third thing I want to say is just know cellulite can be more noticeable after surgery, and especially if after surgery you continue to gain weight,
Mm,
it'll be a lot more noticeable.
Yeah.
I did. I did.
Lastly, this is the $1 million question. How long do the results last?
So yes, the $1 million question. So obviously, like everything that we have on our website and like that I can say from a representative standpoint is all per the FDA. But I'll kind of explain it like how that works too. So initially, when the device was launched, we had data from our clinical trials that was out. We had patients looking at from before and then at like 3 months, right? So like we could show, okay, at 3 months, like this is what the result looks like. And obviously it's still really good. Then we were able to go back after we had our 12-month data, which was actually published in the journal as well, like one of the premier plastic surgery journals, that showed these same patients, but now follow-up data at 12 months. So that's what we have right now. We have follow-up data up to 12 months. And if you go onto the Aveli website, myaveli.com, it actually, any of those photos that you'll see there, or even on our Instagram, are all out to 12 months showing long-term results. So what we can say is it's a long-term reduction of the cellulite. But if you look at like other subcision like Cellfina, where you have sort of subcision as precedent there, Cellfina ended up with a 5-year clearance of cellulite because subcision works. So will we go back and submit for additional, long-term? We have to continue to follow those patients, but we've been out on the market since April of 2022. And as of now, right now we have 12-month data, but hopefully that helps to kind of answer your question, but we're not seeing at that point that the results are not, that are like going backwards. Like we're still at where we were after the 3 months.
Awesome. So, lastly, before we sign off, I want everybody who's listening to know that I'm super excited that we finally have a solution for cellulite. And I've been kind of sitting on the sidelines waiting, talking to different surgeons and finding out the real information. Because, of course, on the internet, you can be sold anything, but finding out the real information and hearing from actual patients and hearing from surgeons that are using it, and you're hearing the same message that it's working, that the results are really good, and that the downtime's not bad, and that patients are loving it. So then, if it's like that, I'm 100% all in on it. So Aveli is the solution for cellulite. And the last thing is, what's the price range?
So it's really going to depend on your provider. And so I'll give you a range of what the charges are, but there's some providers that are higher than this. And then you're going to find also like, well, they'll run a special or something. But on average, depending on the severity of the case and how long it might take, anywhere from 3,500 to 5,000 is kind of the range that we're seeing. And again, remember, it's a one-time treatment. Like they're going to mark every cellulite that you have. And if you want to treat butt and thighs on the same day, you absolutely can. But to Diana's point too, like I've had patients who are like, the opposite of you actually, they didn't really care about the ones that were on their butt and they just wanted to treat their thighs. Totally fine. Like it's customizable. We can do however much of your cellulite you want to do. You just have to discuss that with your surgeon or your provider. But yeah, so anywhere from 3,500 to 5,000, it'll depend on, the severity of the cellulite, like how many dimples, which is essentially a factor of time. And how many areas that they're going to treat on that day. But I think that's a pretty good average for your patients or your listeners to kind of gauge.
On safeguards, that's some of the most important stuff we talk about on this show. Who should be doing this procedure? Who's allowed to do this procedure?
It'll vary state to state as well. But our launch was to plastic surgeons and like cosmetic dermatologists. And then within like either a plastic surgeon office or med spa space attached with a plastic surgeon's, like you're like run of the mill, like in a hair salon injector will not likely be offering Aveli. But if it's a nurse that's in a plastic surgeon provider type office or med spa, they can be trained. So either a nurse practitioner, PA, or a nurse within those confines can also do the treatment. And we have some amazing nurses. And
I believe you. Trust me. I know.
A lot. Yeah. So as well, and to your listeners too, or anyone that's considering Aveli, we are a very small team working across the country. And we are not just like, I get calls all the time. Somebody just like, well, I want to try it. Or like, yeah, I heard about it. Like, can you just like bring me one? No. Like, I am not just like sending these out to people so that they can just like, put it in there and not know what they're doing. Every single provider that we have on the provider locator, they don't even end up on the provider locator until we've trained them. So someone from Revell Aesthetics has gone in to train fully on the procedure and the device, every single provider that you see on the provider finder. So that is the only way that you end up on there. So you can rest assured that anyone that you find through the provider finder in your area has been vetted and fully trained by the company.
Oh, perfect. This is what I want. This is what I wanted you to tell us.
Yeah. Yeah. No, it's not just something that is out, for people to just call up and order and just use like as they wish. It's still a blade. It is still a little cutting tool, and I would not want that in the hands of just anyone. Like it's still something that regardless of all the tools that your surgeons may have, like they can have all the best tools, but they still need to know how to use them appropriately. And so we want to make sure that all of our outcomes and all of our providers are properly trained so that we have great outcomes.
But that's always something that we have to be cautious of. And I want to take this chance to talk about not just Aveli, but any procedure that you're having done, any type of laser, microneedling, any type of deep peels, any type of lasers, they have to be in the right hands in order to work properly and to not harm you. So there's something I've seen a lot of, like patients or women who have RF radio frequency to their face, and then they end up losing a lot of fat. They end up with more loose skin. So that has a lot to do with how deep are they going? Is the person doing the procedure, do they know what they're doing? So this goes along with all of that. Finding the right provider to do these procedures is essential to getting a good result, because they have to know how to do it and they have to be very, very skilled at doing the procedures. So that, you guys, I love spas that are attached to plastic surgeons, because the plastic surgeons are very hands-on usually with their spa and providers, and the nurses, the nurse practitioners, the RNs, they're trained alongside their surgeons a lot of the time. Wouldn't you agree, Leslie?
Yeah,
The
for
nurses
sure.
are learning side by
As
side.
compared to, because when we say med spa, like there's lots of these sort of ideas. And I think what the general population doesn't realize too is that as long as I can speak for at least in the state of California, as long as you have someone with an MD at the end of their name as your medical director, doesn't really matter what specialty it is. It could be emergency medicine, it could be a pediatrician, and they can be the medical director of a med spa offering, laser treatments, injectables, and like if things go wrong, like you're literally calling, let's just call it a
Pediatrician.
pediatrician, yeah, to be like, hey, I'm having a vascular occlusion or whatever. So absolutely, I feel like when I know it's like a whole other podcast, right?
That's a whole other episode,
But it's
girl.
important that people realize that like you should. I mean, I don't. Is that a question you should ask? Yeah, I probably would. Like, who's your medical director? Because if something goes wrong, like who are you calling? So absolutely, like if med spas with either a derm, because a lot of cosmetic derms have great med spas too, or plastic surgeons, yes, those are always going to be your best bet because they have usually the best training. You have somebody who actually knows what to do if something were to go wrong and how to fix it, literally in your, either next door or like around the corner.
I also want to say each state has different rules of how close that provider has to be to the medical director. So I know there's different rules per state, but here in Texas, I think there's like a 10-mile radius or something. Like the provider. It might be wrong. So if I am, y'all can send me a message on Instagram. It might be 3 miles. I don't remember. Within the radius of the office and where the medical director is going to be in case of an emergency. And the vascular occlusion that Leslie brought up. So that is something that happens when you get filler and they have filler that somehow ends up blocking some sort of blood vessel. And when that happens, you can have a tissue necrosis, you can have a lot of problems. And this is one of the reasons why you can't have filler with just anybody. You can't go to just somebody you find on the corner because things can go wrong. And when they do, you have to know that the person that is taking care of you knows how to protect you and make sure that that does not move forward. And that's other thing on that is a very well trained injector will catch it without letting you leave the office. And that is the most important thing that they could do in that scenario, catch it before you realize something's going on by your tissues, something's happening to the tissue in your face or wherever you had the filler. So that, you guys, on this show, we always talk about staying safe. And these are the things that you do to stay safe. Make sure that you're going to providers that are qualified. Make sure you're doing procedures that you've done your research on. And the last thing is you don't go by price. You go by skill and qualification.
Always.
Totally.
To your point, I think a lot of the guests that you've had on your show too, and a variety of surgeons like there, and I think you say this to your followers all the time too, Mavi, is that doesn't mean that you have to go pay a lot of money. Like there are great providers in everyone's price range. Like there is someone for everyone. You don't have to spend, $1 billion to like look good. There are great providers for everyone's price range. And just like in the range that I gave you for the Aveli procedure, like you will find someone that will align with what your budget is. That is also a good provider. Like they don't have to be, not the best. And then you're like, oh, it's going to be less expensive. There's amazing surgeons that offer their whatever they're providing at really reasonable prices that are attainable to all patients.
You know what, Leslie? You and I, we know this because we're behind the scenes and we've seen a lot and we've seen a lot of surgeons and all of that. But for the general, somebody who works in a bank or who's an attorney and they're thinking about plastic surgery for the first time and they're starting their journey and they don't really know a lot because this is something so foreign to them. Like, for example, that's where the play on words comes in with double board certified and cosmetic surgeon and all of these different things. And something that I've been getting, I actually had a conversation with one of my clients yesterday. She was like, I told my husband that I was hiring you to help me find my plastic surgeon. And he thought, why do you need to hire somebody to help you find a plastic surgeon? And she's like, this is literally the most important decision I'm making in my life. Like, this person's going to cut on me. I could get botched. I could die. They could puncture my intestine. She's like, you don't even know. So why would I make one of the most important decisions blindly without really knowing anything about this industry or anything? And she was a CEO in her company. She's like, I know the ins and outs of my industry and how dirty it is. She's like, and I know that my industry is not alone. So if this goes on into other industries, then I don't want to walk into something because I'm clueless about this industry and what goes on in it. So I thought that was really interesting because she's like, at the end, I told them it's like hiring a realtor. Like, a realtor can tell you things that you don't know because they've been in the industry, they know a lot. She's like, it's the same thing. You're making a really important choice and a really big purchase and a big decision. And she's like, why would I do it by myself?
Yeah.
You go do it by yourself. And Diana, know a lot about this industry from both sides, from coming in not knowing really a lot. Actually, you were working in a bank. So why don't you tell us a little bit about that? We have like 10 minutes. So tell us a little bit about how that was, because you actually experienced it.
Well, yeah, and especially at the time. So when I started my plastic surgery research journey, yes, I was working at JP Morgan in the corporate office, and it was a very overwhelming space, and there was nowhere near as much research information. And this is just 3 years ago, three and a half. So not even that long ago, but there was like so little information. So I, again, just went by my common sense and like, okay, let me talk to several plastic surgeons. Let me make sure that they're qualified. Obviously, that the basic research, like how do you choose a plastic surgeon? One of the things I kept seeing is you want to make sure they're actually board certified by the Board of Plastic Surgery. Okay, so I found the actual website. I found several surgeons, and then I just started the process by talking to them. And ultimately, had to listen to my gut instinct, because I've spoken to several where I saw tons of amazing reviews and pictures and everything, but like there was just something like not right on the inside. And then at some point, I prayed about it, like, please give me a sign that's obvious. And I kept seeing Dr. Azizi pop up all of a sudden. And I'm like, oh my God, what are the odds? I'm in this like massive 10,000 plus people Facebook surgery group. And they keep bringing up this plastic surgeon in my city, which at the time was Chicago. And I looked him up, and then I scheduled a consult, and it immediately felt right. I was like, wow, this is the one. I love his work. His reviews are amazing. He's board certified. This is it. And then I kept, talking to some people, some of his patients. There was a Facebook group of his patients. Everything was just like, it felt right. And I went with it. Yeah.
It worked out, and it worked out for you. You had great results. You had a great surgery recovery. Everything
Yes,
was
absolutely.
fine.
Everything was safe. Yes. And I was very well taken care of.
I'm happy to hear that. So with all of that, for our listeners, number one, we have a solution for cellulite. Number two, it's not that expensive. It's really not that expensive, in my opinion. I don't think it's that bad
For a one-time treatment. You don't
for
have
a
to do it.
one-time
Right.
treatment.
One time. That's like the best part about us. Another thing that I was like, wow, I don't have to go back a whole bunch of times. I can sit right away.
Yeah.
And by the way, sitting, like, it was barely sore, like barely. I had no problem sitting down. I was more sore. I had a tiny little area on my right upper thigh, which was kind of connected to my butt cheek. That part was sore, but I had lipo there and I had J plasma there. But the everything else, I was perfectly fine sitting. So yeah, it's amazing. It's amazing.
I remember somebody in your comments on your post was like, you sat? And you were like, yes.
You know what?
I was sitting.
Because my butt was swollen. It looked amazing, by the way. I miss it already. But somebody was like, people thought I had a BBL again. I'm like, you guys, no.
You're
Who
like,
do you think I am?
At some point, but it wasn't this.
Right? Not this time. Not this time.
Okay, Leslie, before we let you go, I always like to ask for one piece of advice that you would give our listeners on their journey to if they're listening to this episode, maybe it's about cellulite, what is one tip that you would give them on their journey? If it was your mom, your sister, your best friend,
As related to just surgery in general?
just from you guys, Leslie has been in the industry for a very long time. So from your experience being in the industry, and then for picking somebody for Aveli.
Gosh, I think if I had to just give one thing, and it's something I try to tell even just like my friends and stuff, is like you were saying, Diana, is trust your gut first and foremost. Like you will know if something's not right. And that feeling is real, very, very real. If you're in a consultation and something's just off, listen to that. So I think the best piece of advice I could ever give to somebody is to truly, truly listen to your gut instincts, and follow any kind of negative or bad vibes that you're getting. Listen to it, walk away, look for someone else. That's not the person for you, because you will. And I think that you've experienced this too with your clients, Mavi, and I've had surgery myself. Like when you find the person, like you will know. It's like dating. Like you will
Yes.
know, and you'll be like, this is the one.
Exactly.
Yes. Yes.
I had a post on my
100%.
Instagram today about if you book with a surgeon without meeting them, it's like marrying somebody you met during
Yeah.
a round of speed dating.
Like what is
Like
that show called? Like Love is Blind.
Love is
Yes.
blind.
Should not be surgery should
Mm-mm.
not be blind. Like
Nope.
absolutely not.
Should not.
Take it
Absolutely not.
for a spin, go meet them, see the vibe in the office, like kind of part of that, like trust your instincts. If like you go for a follow-up consult and there's like somebody new at the desk, red flag. Like, why is there someone new already? I was just here 3 weeks ago. Like
Yep.
little things, like look around, feel it, all like there's signs all around you telling you like if this is going to be the right place for you or not.
Absolutely. You know what? That's a really good point, Leslie. If the office has a lot of turnover, if they don't really keep the same people, that is a huge red flag, because I can tell you
For
from
sure.
experience, and I'm sure Leslie, you can second this, like when plastic surgeons have their staff and they're a really nice run, well taking care of their patient's office, like their staff stays for a long time. Like we fall in love with our jobs and we fall in love with our patients, and we're just there to help them as much as we can. So that comes from the top. It comes from the top. So if you have an office where you don't feel that vibe, just know that's coming from the top.
Yep.
Mhm.
Yep.
Always. Yeah. No hate, because like I know the hiring environment right now is difficult. So it's happening here and there. But for the most part, you should see a pretty consistent office environment.
Okay. So one thing, Leslie, I get often from my followers now that I'm posting a lot about my Aveli journey is people are concerned with if the septa is cut, is it possible that you may end up with some skin sagging on your booty, for example, or on your legs? Like what insight do you have there for us?
It's a great question, and it's a very valid concern. And so again, this goes back to like choosing the right provider, that they have the appropriate training, because it's going to be something that the provider has to explain and kind of differentiate with the patient. So, and this is something that we as a Revel Aesthetics is really committed to also. And when we have presentations and such, we often put up an image of like the woman that's walking into most of these offices, right? Like they have like sagging breasts from breastfeeding their children and diastasis and their loose hanging skin. And then like the saddlebags and the flat butt and like and cellulite, like, and it's just this whole thing, right? So we have to look at a patient there's a global approach to like how we're going to treat her. And so we've got a solution for the, diastasis, tummy tuck and the breasts, and, we can put volume into the butt, but we hadn't had something to sort of treat the cellulite part. When we look at, the legs and the butt and the thighs, there's usually a combination of loose skin and cellulite. And loose skin usually looks like kind of like a crepiness, like if you took a piece of tissue paper and put it in a gift bag and then kind of try to lay it out, and it just has these like little lines. That's usually not cellulite, but women will look and be like, I have all this cellulite. It's not all cellulite. There is some there, but some of that is loose skin. So we don't want to treat anything that's loose skin with the Aveli, because we don't want to like release that septa that's then going to like, yes, like it's going to cause that to hang, become more noticeable. So you'll discuss other treatment options. And there's tons of things that you could do with your surgeon to treat either the volume loss or the laxity, either the lateral butt or the lateral thighs is usually kind of where you see that. Now, in addition to that, that's also why I think big difference between Selfina and Aveli. And really, like, you'll find surgeons still who are like, oh, like I just use a pickle fork. And I'm like, okay. And if you don't know what that is, like, Google surgical, and it's like a very traumatic surgical instrument. And you just are kind of going in there like with a sword and sweeping all of the septa. Like it's not, like nobody wants that in their butt. Okay. So that's what makes Aveli really, really unique. I don't want to cut any septa on your buttock that's not causing this depression. If I over release and I just go in here like with a sword and just sweep it around, I'm going to release all of your connective tissue and cause that to happen. So if they've done that, or the surgeon's like, well, but that could cause sagging skin, or I've heard that it can cause sagging skin. That is user error. Like you are releasing way too much septa that you should not be releasing. And you shouldn't be releasing anything that's too close to the gluteal crease, like where your butt crease is. Like, I don't want to be releasing anything there. Like, you need that fold. Like, that's holding your butt up. Also, an area that we didn't talk about is the banana roll right between your gluteal crease and at the top of your posterior thigh or the back of your thigh. Like, if you have a dimple there, if I'm there with my providers, I'm like, let's leave it alone. Because again, it's just like lipoing that area. Like a lot of people want to like lipo the banana roll, or like, and there's some surgeons that will do it with some finesse, but it's risky because now think of it like, especially if you've had a couple BBLs, like what is going to hold that BBL up? Like it's a little shelf. You kind of need that. So you need to be careful about where you're making releases and how many releases you're making. I don't want them in there. So, you're making sure it's like super, super precise. So long answer to that question, but is it a concern? Sure. If you have a provider that does not know what they're doing and they're going in there with a totally, they're like, oh, I release dimples with my 18 gauge needle or my pickle fork. Beware. Like they're just kind of going in there blindly and they could over release your connective tissue that you need and cause you to have more loose skin. So if it's targeted and we're just releasing just those dimples, you should absolutely not have that problem.
Does that connective tissue grow back?
So that's what we're seeing so far with our long-term data is that like we are not seeing it come back. Now, if you fluctuate in weight, if you get another BBL after you have that Aveli done, could you see new dimples? Yes, and that's also because like as you continue to add fat, like you've got connective tissue everywhere. The volume that you have right now, it looks great. You add more volume, that's some of those septa might now become tighter. Like there's not enough room around them. So you might see a new one that you didn't see before because there's more fat there. So could you develop new areas of cellulite? Yes. But where you had connective tissue and it was what we're seeing so far is that no, it's not, at 12 months, we're not seeing it back. And there's, most of those patients in the studies, they didn't fluctuate in their weight or anything like that. So if you kind of maintain, just like with everything, right? Like lipo is not a weight loss procedure. You get liposuction and you maintain with diet and exercise, like your results are forever. Like it's going to last you a long time. You don't do that, not a whole lot of promises we can make there.
Well, thank you for answering that question for me.
You're welcome. No, it comes up a lot. And I think that it's a myth I wanted to bust because there's a lot of chatter about like, oh, I'm going to, your butt's going to drop and you're going to get all this loose skin. Not if done correctly, not if the device is used in the way that it was intended.
Yeah, technique is everything. It's just like with my sewing machine. Like anybody can go and buy a sewing machine, but these fajas, the way that they're being altered with the same sewing machine somewhere else, OMG. I'm just like grabbing my head like this is terrible. So yes, it's all about user. The technique is everything.
And plastic surgery, right? Like this is also artistry. So it is also the provider's visual eye, their aesthetic, and it's how you end up choosing like your BBL surgeon. Some people want like a really natural, Pilates look, and some people want like full vixen, like mass volume, like choose accordingly. Like you'll find a surgeon that aligns with that aesthetic because it is artistry. So it's also your provider's vision and artistry.
Absolutely. I don't know if you remember, Leslie, but I kept saying about Dr. Marshall that he was like a high-end designer in the operating room. He was doing such a good job. Yes. And that's actually one of the things that attracted me also to choosing him for my touch-up is the eye. Like, do we share the same visual aesthetic for what I want my body to look like and what you create in the operating room? So yeah, that gives me a lot of
chances are, like, you know, yes, it's a very customizable procedure, like all of these surgeries are, but like at the end of the day, everyone kind of has like Picasso had a style, right? Like that's how he painted. So you really want to look at all of the before and afters to be like, you know, chances are you're probably going to look like that, you know, or a version of that. If that aligns with you, if you're like, yes, this is what I want, then that's probably the direction you want to go in. That's probably the surgeon for you.
Totally.
All right, you guys. So that was our episode on cellulite. I'm so excited. We finally have a solution. And so the website is
myaveli.com.
myaveli.com.
Yes.
All right, guys. Thank you for coming on the show. I'll see y'all next week.
So if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible. But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.